Beginning in June of 2023, all medically important antibiotics currently available at many feed or farm supply stores will require veterinary oversight in the form of a written prescription from your veterinarian to be used in animals, even if the animals are not intended for food production. During his presentation for the third session of the 2023 OSU Extension Beef Team's Virtual Beef School, this is how Dr. Justin Kieffer explained exactly what this announcement and the subsequently released GFI 263 will mean for livestock owners.
Garth wanted me to cover some of the impending antibiotic regulations that are coming on here in 3 months from the FDA that's going to impact you as the beef producer. So our animal drugs and actually human drugs are all regulated by the Food and Drug Administration under the Food, Drug, and Cosmetic Act. And that's the act, along with a few others, that regulates the drugs that we can use in animals, especially in beef cattle. So the way the FDA talks to us as medical professionals, as veterinarians or physicians, nurses, things like that, is they give us what's called a GFI, or a guidance for industry. It's the communication they send out to us via PDFs, and they basically say, hey, we're going to use this, we're going to adjust this type of regulation based on federal law. Please issue your comments before we make a final ruling. And this is how we understand how the FDA is going to change regulations that impact us as practitioners. Back in 2013, in December of 2013, the FDA came up with some new rules for antibiotic use to help preserve the antibiotics that we use in livestock to prevent the emergence of antimicrobial resistant organisms and prevent the prospective transfer of those to people, which is important. And so they actually removed the medically important antibiotics for use in livestock for the purpose of growth promotion. There were some drugs, tetracycline, for example, was one of those that was labeled for growth promotion, at least in swine. I'm not sure if it was in cattle. And they removed those labels. They also changed all of our feed antibiotics from off the shelf, where you could buy them anywhere we wanted, to VFD status, which was implemented on 2017. You all may remember when Aramycin came off the feed store shelf, and we had to get it through a VFD with our veterinarian. And all the water-soluble antibiotics, let's say sulfa, that you could put in the water to treat your cattle, those came off the shelf and are moved to prescription status, again, in January of 2017. So again, more background. In 2018, the FDA came up with a 5-year plan to support antimicrobial stewardship in veterinary settings. So what does that mean? That is the proper use of antibiotics within small animals, equine and food animals. And they wanted to describe their process in that plan of moving all the dosage forms for medically important antimicrobials, and I'll talk about those in a minute, what those mean, into prescription status. And what we've done so far is we've moved feed to VFD. So if you're going to feed antibiotics, you have to have a VFD that's given to you by your veterinarian. Water-based medically important antibiotics have to be prescription. And now they're going to move the injectable and also intermammary routes, the drugs that you can buy off the shelf, also to prescription. And they did that in 2019. They issued another GFI to us saying, hey, just a warning, we're looking for your comments, but we want to move all the remaining over-the-counter medically important drugs in animals to prescription status. And they published that in 2021, and it comes into effect in June, so 3 months from now. So how does this impact you as a beef producer? So the drugs that are available over the counter that you can walk into Rural King or Tractor Supply or the local feed store and grab off the shelf with no prescription from your veterinarian, they're impacted by GFI 263. And I've listed some of those here, and I can get you a complete list if you want, but I've tried to pick out the most popular ones that I've seen producers grab. So penicillin G, agricillin, there's lots of commercial labels out there for penicillin. That's going to come off the shelf. Benzathine penicillin, so Durapen, Comapen, that will come off the shelf. I don't use benzathine penicillin, by the way. I call it long residue penicillin, as my pharmacologist friends have trained me on. Doesn't really get to the levels that we need to treat the bugs that we're worried about, and it has a really long tail in the body of the animal, so it actually increases the risk of antibiotic residue. So that's why I don't use Durapen anyway. Oxytetracycline, so LA200, Biomycin, Agromycin, those drugs you can get off the shelf. That's becoming script. The sulfa products, sulfadimethoxine and sulfamethazine, that includes tablets as well as injectables. Thailand, lincomycin, it's not approved for cattle, but it is approved for hogs, which is over the counter. Cefafrin, which are the intermammary products for dairy cows. gentamicin and chlorotouchcycline, the scour tablets, those are coming off the shelf and become prescription only as of June 2023. So what drugs are not impacted by GFI 263? So ivermectin, your deworming agents, moxidectin, which is sidectin, all of your ionophores, which are lasalacid, your Rumensin, Bovatec, salamycin, vancomycin, are ionophores, which are not medically important. We can't use those in humans anywhere. They're toxic to people, but we use them for feed efficiency in cattle and for prevention of coccidia. Those are not affected by this rule. Tiamulin, core that we use to treat coccidiosis, and other non-medically important antimicrobials as defined by the FDA are not going to come off the shelf. They should be available to you without a prescription. So, let's say it's June 2023, how do I access these drugs once they're restricted? So when the labels change on those drugs and it says caution, federal law restricts this drug to use by or on the order of a licensed veterinarian, means that you will no longer be able to grab that drug off the shelf. You'll need to work with your veterinarian to get them to use them in your operation. And the guiding principle behind that is that the veterinarian for the FDA is responsible for drug use oversight on farms. This is also true right now, even for those over-the-counter drugs. They're making it official, and that's through the concept of a veterinary client-patient relationship, or a VCPR. Okay, what is that? So if you pull up the Ohio Revised Code, a VCPR is a legal definition for me as a veterinarian to understand your operation and be able to provide prescriptions to clients, for your livestock. And that has to be through 3 conditions. That means the veterinarian, me, has to be responsible for making clinical judgments on your cattle, evaluating them, providing advice for treatment, or directly providing treatment for you, providing medical services, emergency services, things like that, and giving you instructions and treatment protocols. I have to, as your veterinarian, have knowledge of the patient, which means knowledge of your operation as well, and been there for timely visits. And that timely visits term is defined by the FDA as every year, at least yearly visits. That's how most veterinarians assume that timely visits verbiage means. It's at least once a year. And that vet has to be available for follow-ups. If they're treating animals on your operation, providing treatment protocols, they have to be able to follow up if you have further issues. That's how I define a VCPR. That's how I, as a prescribing veterinarian, have to have that legal relationship with you, the client, to provide you prescription drugs. So why would you need a vet to use the drugs you've always used in your operation? I've used Pen-G forever in my cows. I've used Oxytet on my operation. Why do I need to have a veterinarian guide me? So, as veterinarians, we're trained on the types of antibiotics available, all the drug classes. We've been through lots of chemistry, lots of painful pharmacology lessons on how they work in animals, how they're eliminated through the body, whether it's feces or urine, what the residues are like, withdrawals to observe, which bugs they work on, and how to implement them in cases and when not to. And in some cases, antibiotics may not be appropriate at all for treatment. We may have been treating for years with an antibiotic that may not be effective. Let's say we have a case of mycoplasma on our farm, head tilts, respiratory disease, and we're using penicillin for that. Well, penicillin treats cell walls that mycoplasma does not have. That's just kind of a case in point there, where veterinary guidance can actually direct you to not using a drug at all, or using the right drug that's labeled for that particular condition. That's why having veterinarians' advice for these drugs is really important. Also, for prescribing the right antimicrobial therapy, the right antibiotic therapy that can reduce the need for long-term treatments or repeated treatments, treating calves 4, 5, 6 times, and writing proper treatment protocols for you to follow, because drugs cost money to buy, they cost money to give. We have to observe slaughter withdrawals, have to keep treatment records, and they're all kind of expensive things to do. So we want to limit the amount of drugs we use to save costs, and also to slow the development of antimicrobial resistance in animal pathogens. Antimicrobial resistance is a big issue, and they are addressing this on the human side. I think that's the biggest driver of antimicrobial resistance, is the use in humans, but in livestock, it is important too. We use a lot of antibiotics, and we have some issues in livestock, especially in cattle, where we've seen some worrying development of antimicrobial resistance that we need to address in our own house. I've seen strains of salmonella out there that are resistant to all the available drugs. Gotten those reports back from the diagnostic lab that say, have a little letter R next to all the legal drugs I could use to treat that salmonella case, and that's kind of alarming. If you search the Kansas State Diagnostic Lab, every a few years they publish a nice list of the bovine respiratory bacterial pathogens like Pasteurella and Manheimia, and the number of isolates they get in their lab from feedlots and cow-calf operations that are resistant to Draxin, to tetracycline, to all the other different types of important antimicrobials we use in respiratory therapy in cattle. And those are pretty alarming too. So we need to kind of keep control of the antimicrobial resistance within our own house. If we ever do get a new class of antibiotics approved for livestock, or at least approved for humans, the chance of that drug getting a label to be used in cattle or swine or sheep and goats is really, really low. So we need to preserve the antibiotics that we have now and preserve their efficacy so we don't lose the chance to use them when we do need them. We do need to use them in certain cases.